In this episode, we speak with Mike Uchrin, CEO and co-founder of Monogram Health, a leading multispecialty value-based provider of in-home, evidence-based care and benefit management services for patients living with polychronic conditions, notably chronic kidney and end-stage kidney disease. Backed by Frist Cressey, Norwest, and TPG Capital, Monogram Health has numerous value-based partnerships with leading health plans, integrated delivery systems, and risk-bearing primary care platforms to care for patients across 35 states and all insurance products. Previously, Mike led the growth of Health Choice, the managed care and insurance business unit of private equity-sponsored IASIS Healthcare. I'm your host, RJ Lumba. We hope you enjoy the show. If you like the episode, click to follow.
RJ Lumba is the managing partner of Growth Cap and the executive chairman of Market Insight Media. He is the host of Growth Investor, a podcast featuring today's best investors, executives, and founders. In the minutes ahead, we'll uncover insights and strategies for accelerating growth and succeeding in business.
Mike, thank you so much for joining us today. It's a delight to be with you.
Likewise. I'm excited for our conversation today.
As I was saying before we hit record here, this is the first of its kind, the first time I've interviewed someone that I went to high school with. And we have to thank Shu Mukherjee for putting us in touch. He sent me a text while you guys were together, I think at the Bruce Springsteen concert. And he says, "Hey, do you know Mike?" And I was just so delighted because you lose track of people, right? Like in the decades past, and you've become a very successful executive in the healthcare space. We'll get into that. And I was just delighted to see how things turned out for you. So great to chat with you. Why don't we get started with Monogram Health? Tell us a little bit about the company you lead and founded.
Yeah, I really appreciate that. And yes, surreal, right, RJ? It's been 20 plus years since we last connected, and we're classmates back at Christian Brothers Academy in good old Lincroft, New Jersey. And so for over 6 years now, I partnered with former Senate Majority Leader, former heart-lung transplant surgeon, Bill Frist, to co-found Monogram Health. Monogram is a value-based multi-specialty provider that's tech-enabled, and we treat and deliver longitudinal care management for patients with progressed polychronic disease, notably chronic kidney and end-stage kidney disease. So you can think about us as you would as a normal course multi-specialty provider in having a focus across the continuum of metabolic disorders. And as we age, as our US population ages, we accrue more and more chronic conditions. And really that is what we've set up Monogram to treat. And doing so not necessarily in a clinic setting, but in the setting and environment where we are all most comfortable, in our homes, right? And so as we age, it gets harder and harder to be mobile and also to keep up with not only all of our physicians, but also all of our medication therapies. And so what we've tried to really distill that down and take all of the chaos and complexity out of it is to, one, bring our care, our physicians and nurse practitioners to our patients' homes and really tackle a majority of the prevalent chronic conditions that seniors have in this country, part and parcel of chronic kidney disease, to deliver better care.
Now, you've scaled very quickly. You've brought in capital. The company is in a lot of locations, well on its way. But what enabled that, I believe, was your prior experience and leveraging that. Can you tell us what you did previous to Monogram?
Yeah, so for the 15 years or so prior to co-founding Monogram, I ran the insurance and managed care subsidiary for a large health system. And the portfolio of insurance products really focused in on government-sponsored health plans, everything from Medicare Advantage, dual eligible plans, so D-SNPs, C-SNPs, as well as Medicaid health plans and individual exchange in the post-reform ACA era. And where one, through that, really was able to understand and garner my passion, which really sits at the intersection of underserved communities and chronic conditions. And so with that, just saw the lack of clinical wherewithal that most government sponsors health plans had with regard to chronic kidney disease. Most health plans have really, really good cardiac, diabetes, oncology programs, but in terms of nephrology, renal, kidney, they really didn't have the clinical expertise. And so that's really where the ideation was starting to form, because here we are, those government sponsored health plans have the highest prevalence rates of individuals with kidney disease, but yet they lack the clinical wherewithal. And so saw that opportunity and set out to develop a Monogram really as a turnkey solution, both in terms of the required clinical programs, the complex case and disease management that's needed, and the programs that are needed to manage hospital stays, hospital discharges, as this is a population that requires resources, health system resources. And then last but definitely not least, medication therapy management and next generation pharmacologics, which can really yield great outcomes alongside the provider, the diagnosis and treatment side.
And, you're able to scale, as mentioned, with the capital providers, helping you push your kind of business programs forward. Tell us about your capital providers. You've got Frist Cressey, TPG, of course, Norwest. Maybe start from the beginning, like when you first started building the company, what was that partnership like?
Yeah. And so, I really wanted to start a company from scratch. I look back at that now, and I'm not sure it was the the greatest decision that a father of two and a family of four should have at 42 years old, but it definitely worked out. And it has brought just such a tremendous sense of purpose, because we are truly a mission-driven organization. And one of the things that I got right, and from time to time I can have these fleeting moments of clarity, was really to focus in on who I was going to surround myself with, who we were going to surround the company with. And is why I kind of looked no further than after the first meeting I had with former Senate Majority Leader Bill Frist, because he has a saying, I believe it comes from his father: good people beget good people. And what if you have good people surrounding you, everything else will take care of itself. And so that was the start. And so with that, when we co-founded the company, Senator Frist was launching his venture fund, Frist Cressey Ventures. And within that, he has just been a tremendous partner, a tremendous mentor, and he really knows and understands humans. And he's just been tremendous in letting me run and, doing what we needed to do, and then intervening, intersecting when appropriate and when needed. In Norwest Ventures, at the time, Casper de Klerk, who's still on our board, Robert Mittendorf, who I believe was on an earlier podcast of yours, they bet on our PowerPoint, when we were launching this idea, and they got it immediately and have just been tremendous supporters of the company. And then the large inflection point came when we were raising our Series B and had the opportunity to reconnect with TPG through Dr. Sharad Mazzacani, who's our vice chair, and has also been a great advisor and a great friend, helped us kind of get the guys at TPG up to speed. I had worked with TPG at IASIS Healthcare. And, I think it's important for entrepreneurs, as you're raising capital, to really, more importantly than the capital need, to understand how you want to work with your private equity or your venture or your capital partner. What are the situations, the environment that you work best in? I like to say I'm neurotic on a good day. And so when there's an issue or a problem crops up, I'm going to be fixated on that. I'm not going to sleep. And so you need a partner that's going to kind of let you run, understand your neuroses, channel your neuroses, and help you kind of optimize the way you work. And for us, that was TPG, and blessed to have Todd Sitsky on our board, the president of TPG, and who's had a personal experience. Father-in-law passed away from end-stage kidney disease, and For him, it was personal, and that's what we wanted to surround the board with and the firm with, just to ensure that we were able to kind of optimize the opportunity. And it's really been a great group that are in and around us, and that will continue kind of paving the way. And I think that has also driven our trajectory. To your point, we're now delivering care in 35 states across 27 markets, in just 6 short years.
Leadership is a tricky thing, and you entered into co-founding a company with an august group of individuals. Did you feel the weight of that? Like, there's a lot of responsibility here on my shoulders. I got to execute. To your point about neuroses, how do you then manage all of that?
Yeah, there's been times where, you just feel a tremendous weight. It's taking action, it's making the decisions to get through that, and to always be 3, 4, 5 steps ahead. No doubt, there's moments, I remember our first board meeting post Series B, where as chair, you have, former Senate Majority Leader, you have the president of TPG, Todd Zasitsky, sitting across from Senator Frist. You have Dr. Sharad Matakani, vice chair of Health Spring, and what he's done with Ravi Sachdev at Agilon, Caddy Corner. And it's been because of who those individuals are, so grounded and so focused in on the objective. They create a great environment for really them to help an entrepreneur, a CEO, a growth stage CEO, accomplish what they need to accomplish for the company and the management team. And that's why I just couldn't see myself surrounded with anyone else.
Is there a key focus area for you when it comes to the company's culture and how you choose to bring talent in and the type of talent you look for?
Yeah, and so that goes back to, obviously, being very much a for-profit entity, but believe you can be very much a mission-driven for-profit entity. And so it really, for me, for us, comes down to the sense of purpose. And that starts at the top and being physician-led, with the chair of our board being a former heart-lung transplant surgeon, who said to me in no uncertain terms when we launched the company, Senator Frist said, "Mike, we will be known as the clinical leader." And the impetus for Monogram was really around the poor outcomes the US population with kidney disease has really struggled with. And we can do much, much better for individuals with kidney disease. And so it's one, really feeling the weight of that responsibility that we talked about earlier, and how do we best deliver care to not only drive better health outcomes, but also drive a much better patient experience. And so we were extremely thoughtful, first and foremost, with our clinical model of care, right? What are the clinical interventions? What are the specialties that we need to bring to bear to improve an individual's outcomes with kidney disease? And, very few people have kidney disease due to genetic predisposition. It's all brought upon by unmanaged underlying metabolic disorders that it puts tremendous strain on your kidney function and causes kidney disease to progress. So when you stabilize those metabolic disorders, blood pressure, diabetes, cardiovascular disease, heart failure, you actually in turn stabilize kidney disease progression. And so that's where we've really focused in on this very, very innovative clinical scope of practice, where we widen the aperture of a prototypical nephrology clinical scope of practice and treat all of the metabolic disorders that are underlying as well as driving kidney disease progression. And so it's really rallying our clinical workforce around that mission of doing something different, doing something better, and quite frankly, doing whatever it takes to put the patient front and center and to be our North Star.
Fantastic. What is your biggest challenge today in scaling the company?
I think it's a couple of things. One, as a tech-enabled healthcare services company, at the end of the day, we're only as good as the interaction between our clinician and the patient. And so with that, and as you stated, we've scaled really rapidly, delivering care in 27 markets, 35 states. And so what I am fixated on right now is going to as many markets as possible, as quickly as possible, and engaging with each of our clinicians, making sure that they have the resources, making sure that they understand the ethos and the approach of what we're trying to accomplish. It's a different lens than prototypical nephrology, right? Where you're just focusing in on kidney and renal, but really allowing, the cardiologist to do what they do or the endocrinologist to do what they do. We want and need clinicians that are going to take personal responsibility to manage the longitudinal care that our patients need and require, and to make sure our clinicians understand that. As a derivative of that, the other thing that is really, really hard and that we're fixated on is standardization, right? Ensuring that the patient experience, the quality outcomes, the clinical interventions that we deliver in Birmingham, Alabama are the same as Nashville, Tennessee, same as Philly, same as Phoenix. And so working really hard, not only to develop the most efficacious protocols and order sets that are clinically rooted in the clinical research, but ensuring that those are digitized in our tech stack and that our clinicians can walk through via our tech stack a guided step process to deliver the right care for the right patient at the right time.
We're entering into the tail end of the conversation. I have two standard questions I end with, but I'm going to switch it up a little bit. One of the final two questions is reflecting back on your experience at Christian Brothers Academy. What do you think about in terms of what you learned there? And it could have been tangible or intangible that helped prepare you for where you are today.
I think first and foremost, work ethic. They packed a lot in. And so whether it was academics, it was sports, I think the ability to just develop a work ethic, time management, critical thinking, are all the things that I learned in high school that really created that foundation, that feeling of just pure exhaustion when you've accomplished something, but not being able to describe a better feeling, right, is one thing. Two, I think just developed a great character foundation in terms of doing the right thing for people and weaving that through the Catholic religion, but weaving it through every subject, every academic pursuit. And so it was just grounded in us to handle things the right way and to not lose sight of that, which I just think, especially in today's day and age, values are at a premium. And again, also getting back into how do you treat one another and this mutual respect, especially when you're all running really, really hard, which is a lot of times hard to do, with patients at a premium. But all of those things, I think it probably was a love-hate relationship as we were going through it. But in terms of all the work that we had, we definitely both came out much better for it.
Well said. Last question. Can you tell us about a person or a book that has had a profound influence on you?
Yeah, it's a little unorthodox, but one of the books I've just loved is a book by the name of Relentless by Grover. And he actually started out being Michael Jordan's personal trainer and then really worked his way through to really kind of be his mental coach, and is just renowned in athletics and sports, notably basketball now in terms of what he does, but just really breaking down what it takes to be in relentless pursuit of something. And I read it as we were launching Monogram, and the grit it takes to launch a company from scratch, and really kind of what he saw in Jordan and other upper echelon athletes to just do whatever it takes, right? And so being able to break the character type of a Michael Jordan versus a Steve Kerr, right? Who's a great supporting cast, an all-star in terms of what he does, in terms of, the great shots. But what he referred to Jordan as is the cleaner, right? And, whether it was rebounding, whether it was making that final game shot, was always prepared to do whatever it takes, fill in. And I think there's a lot of corollaries to business in that way. And so, that's a book you can read several different times, and not only from a sports enthusiast standpoint, really get a lot out of it, but also just in terms of business. So I think that is huge. As I think of individuals who, I admire, and I think one of the things that took me a little bit to realize is you don't necessarily have to admire somebody full stock and barrel. You can admire various facets of what they do well, but also of things you're like, well, yeah, I don't necessarily like that or agree with that. So I'm actually going to learn from that and not do that. And so I think there's a ton of different things. So even going back and, probably giving too much away on our collective ages here, RJ, but going back to Jack Welch, the former CEO and chair of GE, right? In terms of how he thought about running initiatives across the numerous GE subsidiaries in terms of these concepts he called bullet trains. He would run a bullet train of an initiative across every single subsidiary, every single division of GE, something I've taken and really, replicated. Same thing in terms of Jeff Bezos at Amazon. When you start a strategic initiative, a really important strategy, write the press release. Nothing is going to help you internalize what you need to accomplish and the results and the why than writing out what you want that press release to look like and be able to tout, and last but definitely not least is, I'll go back to my father. The whole reason why I wanted to start a company from scratch is growing up, he started and owned his own HVAC company. And so, I got to see an entrepreneur from the inside out. And that was somebody that didn't have a high school education, which still, can't necessarily get my head around, but in terms of what he was able to accomplish. And so that's when, I kind of got to the point in the later stages of kind of my professional career here is like, I got to give starting something from scratch a try. And, it's just been a tremendous journey. And like I said, a tremendous sense of purpose here with what we've done and are continuing to do with Monogram.
Well, Mike, I want to thank you again for taking the time to chat with us today. It's been a true pleasure.
Definitely. Thanks so much, RJ.